afternoon, everyone. My name is Kelly Epley, and I'm the Director of Early Learning here at the Hunt Institute. I am super excited to welcome you to this virtual launch of our first of its kind National Child Care Finder Scale. We're really excited about this. For the benefit of anyone who may be joining us for the first time today, the Hunt Institute is the creation of our founder and namesake, Governor Jim Hunt. He was a 4-term North Carolina governor and known as our education governor. The Hunt Institute serves as an education policy support to governors, state legislators, and other state and local leaders, and we cover the full spectrum of education policy from the prenatal and early childhood period through college and career. Today, we're going to focus on a key issue in early learning, helping parents find childcare that fits their needs. For those of you who are familiar with the national early childhood landscape, it will not be news that there's no single cohesive childcare system in the U.S., but rather a patchwork of policies, practices, tools, and resources that states use to address the needs of their youngest children and families. One of the few tools that is part of every state's system, however, is a consumer education website required by the Child Care and Development Fund to support parents' search for childcare. The Hunt Institute conducted a national study to build a scale for assessing state childcare finders or consumer education sites to identify best practices for making finders more informative and user-friendly. During this webinar, you will be hearing from members of our team who worked on the scale, Dr. Preetha Gopalan, Deputy Director of Early Learning, and Kathleen Arney, Senior Policy Analyst. We're also going to hear from parents, state and nonprofit agency leaders, and state legislators from each side of the aisle. While this is a scale and each state receives a score, the main point of the scale is to help states both discover what they're already doing well to help parents and to view examples of features other states have incorporated. This is meant to give you ideas to boost all state profiles by being able to see clearly what's useful in each state. In a moment, I'm going to hand things over to my colleagues, but first allow me to point out the Q&A function in the toolbar. Later in the hour, we'll share some of your questions with the panel. So if you'd like to contribute a question, please use the Q&A function at any time during the presentation. And we'll do our best to address as many as we can. All right, I'm going to go ahead and turn things over to Preetha and Katie to walk through the scale with you all. Preetha?
Yes, thank you. Thanks, Kelly. Hello, everyone. It's been an honor to work on the National Child Care Finder Scale. My colleague Katie and I are very excited to share our findings and policy recommendations with you today. While working to improve the data landscape available to early childhood education is motivation enough, developing this scale, which directly draws from parents' lived experiences with finding childcare, was very energizing. Finding exemplary finders was also inspiring, as we are able to share these robust models with all states to help them improve their finders. We will now share the why and the how of the scale before delving into our findings. Parents across the nation, as Kelly mentioned, face challenges with finding childcare, and Kelly also mentioned the Child Care and Development Fund, which requires that state develop consumer education sites and within them childcare finders to support parents in finding reliable care. Childcare finders provide a variety of features to support parents in their search for childcare, but most parents report that they are not aware of these finders. There is not a lot of research on childcare finders, nor are there established frameworks for identifying strengths and areas for growth. The National Child Care Finder Scale provides a systematic approach to analyzing finders that can help state agencies and legislators work on improving their childcare finders. Okay. So we approached this research. Since there wasn't a lot of research, we used a grounded theory approach to develop the framework, which included a thorough review of the literature, a scan of verified state childcare finders to identify their common features as well as their unique features, and parent interviews with a sample of about 40 parents. While we were aiming to to speak with at least 50 parents, we found after the mid-course point of these interviews that there was a lot of agreement among parents on their needs and interests and their search process. And so we decided at 40 that we had data saturation, which means we really had a strong level of agreement among parents in these interviews. That was enough information for us to develop the framework. The guiding principles informing the framework are uniform scoring. So we use the same framework across all the sites, across all the childcare finders. Platform-focused evaluation, which means that it was about the features of the finder and not how providers or parents use the finder. It was a focus on state finders, which means it wasn't about regional finders or it wasn't about private finders. It was about the state level finder that all parents in the state had access to. And our lens was a growth, given the Hunt Institute's commitment to continuous improvement and being a partner to states, we were utilizing a growth mindset and not looking for challenges and barriers, but rather thinking about how we can support states in continuous improvement. I hope at the end of this session, we will drop the link to the report, the executive summary, and a map with searchable state profiles for each state. But what is very rich and very interesting in our report are the parent voices, which we have peppered the report with. And we've talked about different stages of their search as well in the report. So I really hope you will look at the report and learn more about how parents view this process. Here, we're just giving you a sample from a group of 3 parents. And this gives us a sense of the sort of isolation they feel. Their first instinct is to go to Google to look for something. They often don't find the state finder on Google, and they kind of ask their network, and it's not a very easy process for people. And another theme was it was iterative. So when the child's an infant, you're looking for a certain kind of care. And then as they grow, you're looking for different kinds of care. And each time the process is a little bit, like you have to kind of feel your way around and find a solution. So this is something we kept finding in our interviews. And we urge you again to look at the report and read more of the parent voices. The analytic framework that we developed includes 4 categories: design and integration, user experience, search filters, and provider profiles. And it kind of mimics the journey of the parent. When they're thinking about the search, when they actually sit in front of the computer or their phone and they think about how to do the search, and then the kinds of filters they might utilize to narrow their search, and finally landing on that set of provider profiles, a short list of profiles that will actually help them get to a placement in a childcare facility or a preschool for their child. The scale levels, it's a 20-point scale, and each level is 5 points. So we had minimal, adequate, enhanced, and exemplary. Minimal meant that they had limited or partially functional features. Adequate meant they met a baseline level or basic level of usability. Enhanced meant they had an array of features and could do nuanced searches. Exemplary meant that this site or this finder could serve as a model for other states. Our summative findings show that overall, most of our states, over 2/3, fell in the enhanced category, which means that they had an array of features that were pretty usable for parents. 6 states were at the exemplary level, showing that the country has models that other states can lean on to improve their finders. The map shows you where the 6 states lie, and the enhanced states, the 35 states, and the other states which are at the adequate level. No states were at the minimal level. So the 6 states that are at the exemplary level were led by Florida with a score of 18 on 20 points, and New Mexico with a score of 17.5 on 20 points. Again, if you go to the clickable map on our landing page, we're going to share a link very soon. And if you go to the clickable map, you can click on your state and find the state profile, which lists all four categories, the category scores, the summative score, as well as very concrete action steps for agencies and legislative policy considerations for legislators. I now turn it over to Katie Arney, who's going to share category level findings and the policy considerations.
Thank you, Preetha. As we talk through the categories that we use for their finder scale, I would like for you to put yourself in the role of the parent or caregiver who is searching for childcare. This mindset and our parent interviews really helped to inform our approach. So when we think about the design and integration, this category really begins before the search. Here we asked, can parents access the information that they need, and can providers update that information? So here we really looked at two key categories. Is the information accessible to parents using cell phones, iPads, as well as computers? And is it accessible to parents with disabilities? We also wanted to ensure that there was no login required. We know that that can be particularly challenging on a cell phone. And does it have the information that parents need that is integrated with other state systems like licensure, quality ratings, important information for parents to know when making a decision? We also, again, wanted to make sure that providers had the capability to provide updates to their profile. Here, when looking at the distribution of our states, most states scored around a 3. Some did a little bit better, signaling that this was an area of relative strength for states. One state that stood out in particular was Connecticut. This state had a wholly compliant WCAG compliant profile, meaning that it would be considered accessible to parents with disabilities. This is particularly important when thinking about the accessibility of this information. One area to consider is thinking about the integration of features that allow for economies of scale and reduce administrative burden when providers go to update their information. Our next category is user experience. So this really begins when parents sit down to begin their search. Here, our really important question was, is the finder identifiable? Is it visible to parents? So thinking here about, is it findable using Google, since that's a common parent tool? Is it identifiable using official state seals? Is there a clear call to action for parents? So making sure that the information is clear and accessible to parents, again, here is particularly important. Thinking now about our distribution of states in this area, most states scored a 4. So again, a little bit stronger than our last category, was an area of relative strength for states. Tennessee had a particularly strong site in this category, thinking that it was easily discoverable from a Google search. It had a clear state identity. The filters were well displayed for parents, which we'll talk about in a moment. And there were clear user support options, which is important when thinking about reporting issues with a Finder site. This, again, relates to the visibility of the profile for parents and ensures that it is able to be used when parents go to search for childcare. Our next category is thinking about search filters. This was an area that came up frequently for us when we talked to parents. Parents wanted a way to narrow down the list of providers that came to them once they began using their Finder. So this, again, narrows down the list of options. When we talked to parents, they came up with kind of common filters here that were viewed as essential. So thinking about the location of a provider, does it have the age group that they're looking for? Does it have a high quality rating, right? Things that could really narrow down a parent's search and help them get to that short list much faster. Here we also have a set of preferred options. So something that might be particularly important to a subset of parents. So special needs inclusion, allergy-free options, is transportation available? We consider those strong preferred options. When thinking about our distribution for states here, There were some states that did especially well in this category. That there's a significant number who scored a 5 in this category. Washington, D.C. stands out as an exemplar with strong location options, with zip code or ward options, information about provider type subsidy acceptance, quality ratings. And they also had some strong preferred options as well, including educational approach, language of instruction, and current availability, which is particularly important with parents who have limited time. Again, this category is particularly important for parents who do not have a lot of time when looking for childcare and have very specific requirements they have that they want to set their child up for success. For our final category, we have the provider profile. This was one of the most in-depth categories here. We again separated the menu of options into preferred and essential and preferred options. So our essential categories here are options 1 through 10. So looking at contact information, is there pricing availability, right? That is information that parents absolutely need up front. Timestamp, right? Is the availability of seats in that provider recent. So all the information that can really help parents make a decision about if they would like to reach out and contact that provider with their limited time, or would they like to see the provider in person. For our distribution of state scores here, this was an area of relative weakness for states. Coming down, really thinking again about what is essential to parents, states may consider really looking at what is essential for the parents in their area. Florida is a standout in this particular case. They had a very strong provider template that included contact information, licensure information, ages served. They had multiple different types of quality ratings based on their state finder, including information about school readiness. So this is a particularly strong profile for parents. An area for improvement here may be ensuring that parents have the availability to contact a provider using their provider profile, or that there's clear information about pricing and availability of seats. Now we'll move to our policy considerations for our agency leaders and legislators. This is particularly important as we try to align the actionability of these recommendations with parent needs. In the interest of time, I'll go over them quickly, but please feel free to take a look at the report and the executive summary for more in-depth discussion of these recommendations. So our first recommendation for agency leaders is to enhance the visibility of state childcare finders. Consider ensuring that options for filters are aligned with parent needs. Strengthen templates for provider profiles, and then enhance the options and provide support for providers to make sure that their profiles are up to date. Our policy considerations for legislators include embedding the improvement of childcare finders in larger childcare initiatives, fostering synergies between state and regional agencies that offer childcare finders, and then bridging a gap between childcare consumer education and other family-facing programs. Thank you. Kelly, I'll turn it back to you.
Thanks, Katie. All right. Well, I really appreciate hearing from both Preetha and Katie. They really put in a tremendous amount of work on this scale, and I'm super proud to be able to facilitate their introducing it to all of you. So what we're going to do now is turn to some questions and answers. The first question I have is going to be for all of our panelists. That includes 2 parents, 2 state or nonprofit agency leaders, and 2 legislators, 1 from each side of the aisle. We're also super proud of our panel today. So I'm going to just for a little bit of order and so that we aren't all looking at each other to figure out who goes next, what I will do is ask the question, and I'll first ask our legislators to answer. We have with us Senator Eric Berthel from Connecticut and Representative Suzanne Schreiber from Oklahoma. So this first question is, the scale maps important aspects of the childcare search experience. What stood out to you from the presentation? So Representative Schreiber, I'll ask you to go first. Oh, I still can't hear you. I'm gonna, while we help you figure that out, I'm gonna go over to Senator Berthel. Senator Berthel, would you like to jump in?
Sure. Just ask me the question again because I was.
Yeah, no
Thank you.
problem. So the scale maps important aspects of the child care search experience. So what stood out to you from the presentation?
So, first of all, I think that the whole I, the whole thing is just so incredible in terms of what you have created here, and I think that with respect to that unique piece, it's going to make things so much easier for parents and families who need to find services to find them. And I mean, I realize that sounds kind of simple, but I know Connecticut ranks pretty high. I'm proud of that. I had nothing to do with it in terms of the actual us getting to that level. Perhaps besides supporting good policy here in Connecticut for allowing that to happen, um, but I think that there's so much opportunity here uh, within the states that are at a lower level to come and copy what we've done if you have to. I'm sure that there's some pride and ownership, but there won't be pride in sharing in necessarily and giving away our secrets and how we got to where we're at. But I think that it's so important that we focus not only on the good data that you all at the Hunt Institute have put into this project, but that the people that we are looking to help here, families across the United States who need access to and need to know that there are early childhood programs in their state, will now have well, they've already had it, but now they'll know that it's there. They'll have an easier way to find it, and again, hopefully, the states that are on the lower end of that scale, that lower end, in an ideal world, Kelly, that lower end of the scale would disappear. Everyone would be up in the top ranking.
That's the goal. So
Yeah,
thank you for
I'm,
your comments.
you're welcome.
Representative Schreiber, are you
I have access, but this says that the host has stopped my video, so I can't turn it back on.
All right, we'll get on that, but do you want me to ask the question again while we figure out
No,
who you are?
I think I got the question. First of all, I want to thank the Hunt Institute for this work. I think it's something that's desperately needed in a market that's really hard for families, for the industry itself. It's always challenged. So having an outside organization think about and support this and give us tools about how we can all improve it and create more access to it is awesome. I noticed my thoughts were around the provider profiles and thinking about that piece. And it kind of struck me that that's probably difficult for providers to constantly be updating that. And that's something that maybe an AI tool or really having the most critical information on there so that they can get that current and it doesn't become dated. I think that kind of struck me as probably a challenge in this, is particularly the providers, because often the provider is making the meals, maybe backing up in a classroom, getting the kids, transition from one room to the next, paying the bills. They're doing a lot of jobs a lot of times in these child cares where the margins are really, really thin and staff is really hard to come by. So I just thought that was something that I thought, gosh, I wonder how we could improve and support them in doing that.
And thank you, Representative Schreiber, and I really appreciate that you mentioned how many jobs our childcare providers already have. So while this is definitely a need of parents, it's great to acknowledge, that providers are doing so much already. So we have to think about that when we think about potential solutions. So I'm going to go now to our, excuse me, our state folks. Yuko, could I ask you to answer that question? Oh, you're on. There you go.
Okay. Can you hear me now?
Yep, I can hear you.
Perfect. Um, One thing that stood out to me as I was listening to the research is considering this tool from the end user's perspective and really thinking about the essential details that are according to family needs versus compliance, and trying to see how do we work to continue to make progress in that direction so that the families that need to access this information in a timely manner uh, will be able to have access to it easily.
Thank you. And you know what, Yuko, I should have asked you to introduce yourself right at the beginning.
Sure. Aloha, I'm Yuko Arikawa Cross. I'm the director of the Executive Office on Early Learning in Hawaii.
Thank you. All right. And I'm going to now move to Dr. Grove. Would you introduce yourself and answer the question?
Sure. Hi, everyone. Wendy Grove from the state of Ohio's Department of Children and Youth. And what stood out to me was this beautiful list of sort of minimal filters, but then the enhanced. I mean, it wouldn't have even occurred to me to include in a profile like the educational sort of perspective or how that's done. And I just absolutely loved that. And I think that we will fully take on at least the attempt to try to add much more robust provider profiles in our state, thanks to the work that you've done here.
Thank you, Dr. Grove. And I'm going to move to our parents now. And I just want to say, I think this is one of the first times that we've included parents on one of our webinars. And so I'm just super grateful to have both of them here. I'm going to start with Jem.
Hi, everybody. My name is Shem Lundy, and I'm a parent representing North Carolina. So one thing that stood out to me is looking for childcare is a job. I have two toddlers, a 2-year-old and a 3-year-old. And I know in the research, it said a lot of parents tend to focus on Google, Facebook, and people that they know. This makes a lot of sense, especially with that part in the provider profile around understanding about what is essential to parents. And so I know that a lot of times in like a Facebook group for parents or for moms, it's really easy to just ask another parent like, hey, can you tell me about where you find your schools at or your daycares? And then you'll actually get really good details about what you may be looking for. But I'm also like, I wish that I knew more about the child care finders beforehand, and I can see how this information could be very helpful and useful for parents if they knew about it on the front end.
Thank you. And Charles?
Hi, everyone. Nice to be here. Charles Smith from New York. I have two young daughters, and so for myself and my cohort of friends, this issue is basically top of mind every day. I guess what really strikes me about this is just really how necessary it is. I think, especially for a lot of first-time parents, this is a very anxiety-inducing process that can feel very overwhelming and complicated. And it's also very disjointed. I think you're often going to multiple sites trying to navigate a world that you're just learning, right? So as Jem said, you're often relying on friends or others who have been through it. It's a very word of mouth. And so approaching this from an online perspective can feel overwhelming too, finding the right information quickly that feels validated and trustworthy. I've personally found hard to do. So very happy to be here, and it just feels like a very timely and necessary report to be undertaking.
Thank you, Charles. So we're going to go through just a few more questions. I have 3 questions, one specific to parents, one specific to agency leaders, and one specific to the legislators. So I am going to start, we're going to go in reverse order. I'm going to start with parents. So Jem and Charles, what are features that would help you find the state child care finder when doing a search? What filters and details on provider profiles would you like to see on a child care finder?
Well, I think definitely seeing the state logos and official seals on the child care finder will be helpful, especially for safety reasons. I think As a parent, you want to make sure your kids are safe. You want to make sure you're talking to people who are trustworthy. So that's something that I'd like to see as a feature. In terms of filters, and I know there was a long list of filters you all already went through, but some other things I was thinking through is like, mental health and like social emotional filters would be really helpful as something with our climate being the way it is. I know a lot of us parents want to make sure that our kids are getting that social emotional, definitely more about safety protocols. And so things like, how do you handle a natural disaster at these schools? Or, what happens on a lockdown or a soft lockdown, and what are the procedures at these schools for those types of things? Are there cameras available? So that's, as a parent, you want to know that there's a lot of safety things that are happening. Also, like, teachers' retention, like, are the teachers staying? How long have they been there? So those are some things that I think about. And maybe even like, is there a multilingual education or bilingual education that kids can get as they enter these spaces?
Totally agree. Just to add on to that, I think definitely getting to an understanding around quality quickly is obviously really important. Just having some baseline understanding of how this program ranks and what others are saying about it. Is there violations associated with it? Some of the safety pieces that Jem is talking about. And then on the other side, I just think there's it's like a full-time job again, like Jen said, trying to reach out to all of these different, trying to narrow it down and then identify the places where you might want to visit. You're in communication with all kinds of different folks, and so it seems like there's probably some easier ways to really modernize and in a systematic way, kind of make it easier to contact folks within some of these platforms to organize your searches and whatnot, and make it more integrated and seamless. I think there is a big opportunity to try to kind of house a lot of this stuff in one place versus multiple websites. And so that's where I think there's a lot of potential that could make parents' lives a lot easier, because as we all know, we have limited time and limited bandwidth. And so the easier you can make it for us, I think it would be good for everybody.
Yeah, thank you both. And I really feel like in both of your comments, it's a good reminder of how much is on parents' shoulders when they're looking for childcare. Something that we don't necessarily always have front of mind. So really appreciate both of your comments. For the agency leads, what are some opportunities you see for improvement of childcare finders? What are the barriers to elevating the visibility of childcare finders for parents?
Would you like me to go first again? I can go first again. Is that okay?
Sure.
Okay, perfect. Well, I think listening to the parents, it just reconfirmed something that I was already thinking about when I was looking at this research. I think an opportunity is to think about how do we maximize the use of our parents' time? So, for example, as they're looking for care, how can we also connect them with subsidy eligibility, applications, other early childhood services while they're in the midst of this search? And I think the one challenge with doing that is, I think, insufficient cross-agency integration at this point in time. Sometimes the family-facing systems for um, early childhood are separate from each other. And so when we look at health and human services and other types of resources, these are all in separate locations, sometimes run by different state agencies. And so I think that knowing that time is limited for families, that this is an opportunity that we can probably address through cross-agency integration.
And I'll pop in next. I think there are at least two opportunities that came to me. The first is that often state agencies can be a bit behind in our trust and use of technology. And so I made a note to myself to make sure that we really know how to use technology in the most efficient and parent-friendly way, instead of just sort of pulling in information from existing data sets. Maybe there is some use of AI that we could use in our child finder. The second one I'll mention is that all of us states pay for child care resource and referral agency networks. And I would like to think about, as we update ours, how do we bring them into this? Should there be a way to contact a regional child care resource and referral agency? Would a parent like that option as opposed to going directly to a provider that may work for them? And then I really like what Yuko said about bringing in the different pieces and parts. So, have we done our best to educate our children's services caseworkers, our home visitors, our early intervention service coordinators about how to help parents understand this as a resource? And in fact, your own parent qualitative data said that about, they're going to these pediatrician appointments. How come nobody said anything about it there? So I think those are all opportunities that I saw from a state perspective.
Great, thank you. And I'm especially grateful that you mentioned intersection with CCR&R. I think that is definitely another piece for exploration with this to make sure that those systems are as integrated as possible for each state. So I'm going to move now to questions for our legislators, and you all can go in whichever order you would like. In what ways could policymakers influence the adoption of best practices that will help improve childcare finders and facilitate easier access to childcare for parents?
Representative, would you like to go first, or would you like me to go?
I'm happy to, since
ahead.
you got thrown in last time.
Go
I
ahead.
apologize for my technical difficulties. I have a couple of ideas. I have a bill that I passed last year around recruitment and retention of early childhood. And then this year I have a tri-share bill that proposes to share the cost between the employee, the employer, and the state. And on both of those bills, my thought was just writing into it the child care finder as a utilization tool, reminding everyone that that is something. So if I am an employee of a child care, I can use the child care finder, and that helps me access.
Representative Schreiber, you have frozen, so I'm going to move to Senator Berthel, but I want to invite you back to finish your thought.
All right. So, Kelly, you already know what I'm going to say. I think from response to this, one of the most amazing things that we did in Connecticut to make all of this just kind of come together was to create an endowment through our state budgeting of $300 million a year. And you heard me right, $300 million a year, of which in this first year, we're in the first year of it, we have funded $36 million, which allows families with certain income thresholds to essentially have free access to early childhood services. And the benefit is twofold. Very, very simply, you all know this already. Maybe in some of your states, you wish you had this, or maybe in your state you already have it. But two things very quickly. First of all, we know from, in large part, by a lot of the data provided by the Hunt Institute, that when we get children into early childhood programs as quickly and as early as possible, that they do better in school when they start their K through 12 education. They come out with much better outcomes at the end of that time. They don't end up in prison. They don't end up on social welfare programs. They become better and more productive members of society, which is obviously the goal we all strive for. And second, and the part that is often overlooked, is that when we provide these services to families that could otherwise not afford them, it now allows perhaps that single mom or single dad, or that family of a mom and dad, or a mom and a mom, or a dad and a dad, whatever the family unit is, it allows the other person or the one person to actually go back to work. So there's a huge economic benefit that comes as a result of this. The return on the investment is huge, because now you've got someone who is back to work where they really want to be, Okay. Not that they don't love their children or they don't, or, they don't care for their child, but they're back at work. The dollars they're earning are staying most likely locally in the economy, okay? And they become less dependent on the social welfare programs, which the last thing, we have an epidemic here in Connecticut where we have generations now that have been on social welfare programming. And if it's one of the last things I do before I stop doing this job someday, it's going to be to change that we should be lifting people out of poverty, not just continuing to hand them things. Okay. And our early childhood program doesn't just hand you something. Okay? It's using all of this great data and all of these great services that exist in Connecticut and providing access to them so that good things can happen.
Thank you. Representative Schreiber, I want to give you an opportunity to come back and finish your thought. You're on mute. That's all right. You could also, if you wanted, put your answer in the chat and I could read it out for folks if that's helpful. And while you do that or sort of work with the mute button, I am going to go ahead and start taking questions from the group that's assembled here. We have a ton of great questions. One that came up a good bit is just, oh, there you are. Do you want to go ahead?
I'm here. I don't know if my bandwidth's going to hang in there, but my mentioning is in the legislation that I'm running around whether it's for childcare employees who are getting free childcare, allowing them and writing straight into the bill that the childcare finder is a way for them to find these things. And then when that bill passes and there's conversation about it, because you might assume that the childcare employee wants to go where they work, but often they don't. They want to go next to a grandparent. They want to go close to their home. They have a lot of considerations, just like any parent. So that's one opportunity. And then in my tri-share model this year, where I'll be encouraging employers, employees in the state to share in the cost of childcare, there is a way that we can definitely include that in the bill to make sure that employees are using childcare finders for the state of Oklahoma so that they can get on there. And the more it's in demand, the more it's utilized, I think that creates the cycle of improvement and making it constantly improving. And like I said in my very first answer, I feel like there's a lot of AI tools that can really help with constantly making this something that is fresh, current, accessible, very quickly usable. I think one of the parents mentioned that a lot of people are going to go to their friends. That's the first place they're going to go, to someone that they know. What the childcare finders can do is once you get those 3 or 4 names of a childcare, you put those in the finder and you can get the deeper information about the things that are going on there. Is it available? What is the distance from your home? All of those kinds of things. And I think that's why it's an important tool that the state maintain if we want to have a healthy workforce that can quickly access childcare.
Thank you so much. Thanks to all of the panelists. I am going to go ahead and start introducing questions from our participants. I am gonna, because this came up a few times within the questions, I'm gonna just reiterate that the link for the finder will go live toward the end of this webinar. We haven't put it out yet because this is the virtual launch. I believe our panelists got a sneak preview of the executive summary and some of the scoring, but even they have not seen the actual full website yet. So that will be available just as we're ending. So one of the first questions I want to pose, and this may be for parents primarily, but I think it could be for any of our panelists. From Lisa Sater, I am hearing more concerns about family child care programs having their address published. They're preferring street intersections as they have great concerns about violence these days. And would parents tolerate needing to get the address by contacting the program? I'm wondering if parents, and I recognize that our other panelists may also be parents, so please feel free to jump in. with your thoughts on this.
Um, that's a tough one. I mean, I can understand the safety concerns. I guess my my first gut, I'm thinking of it as like a user of this, like trying to identify actual addresses. I mean, I think so often you're trying to get a sense of place of what this place may look like or feel like, and having an exact address can really help you understand where it is and maybe some other elements to it. Um, totally understand the other side though around safety. And if I was putting my hat on there, I can totally understand and sympathize for why it wouldn't be on there. I would personally lean towards wanting the address, but that's just me.
Any other panelists?
I can add to that. I'm echoing, sorry. Katie and I did have this discussion. What's going on? So we came to the conclusion that in cases where places did not provide their address, we had to score these sites. And so we did talk about like, what are some options? So I can think of two. One is if the template says to protect our providers, we're not giving you a direct address or something to the effect that it's not missing information, but that there's a purpose behind not providing it, which is not always clearly stated. And so it is a bit confusing. You're like, well, I can find something on a map, but it's not really an address. And so, like as a parent who's not totally familiar with this process, that may add a barrier. The other thing is maybe just state something about the neighborhood. It's, instead of an address, they could say, we're in this neighborhood close to all these highways or main landmarks or something. So people get a sense of, okay, how far is this from my work? How far is this from my home? And then, of course, they can add in a friendly way, can you please contact us if you would like more information or something like that. So we just felt it was missing. The information was missing in some sites, which were very good sites, but they didn't have this bridge.
I see you're
I was going to
Trevor.
something similar about if you think of people, if you shop for an Airbnb or something like that, it'll frequently tell you this is kind of the vicinity. And again, an AI tool could anonymize that really quickly to just show kind of on a pin marker on a map, this is sort of where this is. And that might help people. And then also, address some safety concerns.
Yeah, that makes a lot of sense. We have another question here that I think may, I'm also getting a little bit of feedback, so I'm trying to figure out where that's coming from. Maybe for the folks who on our team who really dug into this project. This question is, thinking of streamlining updates with better live updates. For DC or Florida and other states that have been able to show availability of seats and updated provider profiles, how is this done? Are there models of integrations of enrollment systems where there is a system and then networks like staffed family child care networks or navigators that can manage updates manually or in their connected systems? That's kind of a big question. So I can read it again, or if you want to take some piece of that, if anyone here has thoughts about that.
I can jump in here since I dug pretty deeply into the provider profiles. I will say on the provider profile end, it is difficult to say exactly how it is being done. I think the interesting thing is and this was very few states that actually were updating availability on a regular basis because I think it is so challenging and time consuming. On our end, it appeared as though the provider was going in and having to manually update their availability. And then there would be a timestamp that parents could check. I think there are some potentially great options with system integration or potentially AI to help do those things. But that is definitely an area that parents prioritized heavily. They didn't want to waste their time reaching out to places that maybe didn't have a seat for a child. But again, it's also a heavier lift.
Thank you, Katie. I'll also add, and this is to Dr. Grove's point earlier, this is probably an area where leaning on CCR and ours would be helpful. This is information that they keep updated. They're huge support for providers for this kind of thing. And I think too, we probably won't get to all of these questions, but we will take all of these questions and most likely try to come up with some sort of FAQ document or find ways to address them. So even if we don't get to answer your question live, we will take note of your question and do our best to make some kind of response.
Kelly, I
There's
just
different.
wanted to add
Oh, go
one
ahead.
thing.
Yeah.
Also, like Dr. Grove said, modernization of the system is very key. I think the parents are using maybe more modern technology than the systems are using. And so there is a disconnect there. And the updates, for example, if there was a system that was easy to update, maybe it would be easier than like to, access and not multiple steps, like a verification process in the beginning, and then you have like maybe a year within which you can keep doing updates and then you verify yourself again. It's not like too much administrative, too many requirements of providers and adding strain to providers who already have a lot going on. But some system that is simpler, easy for providers and streamlined at the system level. And systems also have multiple sometimes we saw more than one finder in the state, and I saw some questions about that. Which finder did we choose? I think we chose the finder that actually scored highest. So we were just very fair to the state. If it was a statewide finder and we had more than one statewide finder, we chose the one that scored higher because then, that state was represented well. But I think having multiple finders means you have multiple databases sometimes. And again, updates are going to be more painful that way for both providers and for systems. There's more expense, there's more administrative burden, there's more requirements of providers. So modernizing, to your point, Wendy, is really critical, I think. And to Representative Schreiber's point about bundling childcare finders in existing childcare legislation, I think these are smaller steps that states could kind of bundle into larger legislation on childcare to support modernization of finders.
Makes sense. This question that I was about to ask very much may have been answered partially by your response there, Preetha, but similar from Andrea Heberlein, did the researchers identify if the childcare finder sites were custom-built legacy systems or software as a service systems? And if so, was there any correlation of a particular type of system with higher scores?
We did notice there were repeating platforms. So, I don't remember the names exactly, but it seemed that there was a template that states could subscribe to and then customize to their requirements. We saw a few of those, but we did not do that analysis. That's like next level analysis and this statistical analysis, which we haven't attempted. And we could easily try to correlate and see the scores in the platform's level of customization or whether it was, what was the language, Kelly? I don't remember the differentiation between something that was like a platform that was for
Yes, sorry.
provided a template.
Yes. So custom built legacy systems or
Custom built.
like a software as service, like a
Right, software as
package.
service. Yeah, so we could do that. I mean, we have to go back and look at which was which because we just verified what the state verified is the system we use. So we didn't really study which system they had subscribed to or created, but that is something we could do.
Yeah, I think that's a great question. We have one more, I think, probably have time for this one and possibly one additional one before we move on. Lori Ruff had the question, did the finders include a variety of programs such as licensed, unlicensed, religious sponsored, home care, etc.? Katie or Preetha, would you like to take that?
I could take that one. Because these were state level finders, they did seem to include a robust range of providers. So they absolutely had licensed childcare, private options, home-based. There were some religious options. Um, there were very few that offered unlicensed options. So that is interesting to note, although there were some that did not offer their licensure information. So it's possible that there was still an option available on the platform, but they maybe prioritized showing parents licensed options.
And with unlicensed, obviously, there isn't necessarily a clear picture of the universe of unlicensed because they are unlicensed. So those would be very hard to identify, probably pretty unusual to find in a state childcare finder, especially since these are required by CCDF. And they'd need to be eligible to receive subsidies, I believe. Let's see what else. Preetha, did you have anything you wanted to add to that? No? Okay. Let's take a look. What else? There was a question, and this is a great question. So we obviously looked at childcare finders and we talked to parents. Matthew Henry asks, were any providers included in this research? It's a great question.
I can answer that. Providers were not included in this research because we were looking at it from the parent point of view and whether or not they could find it, could they use it, and how would they recommend we improve it based on just the access point of view, like access to childcare is an issue. Childcare finders are an entry point in the access discussion, and we would like to provide usable policy recommendations to legislators and actionable steps to agency leaders to improve these finders. So that was kind of our objective. I think there is a companion piece we could do and talk to providers and see what their perspectives are and if there's variation across type of provider on, how often can you update and how usable is this template? What else would you like to see on this template? What search filters do you think are usable? But I think that's the counterpart, and we could definitely, think about doing that as part two.
Great. Thank you, Preetha. There's a question here from Tamara Walker. Do you know the accuracy of the slots on provider profiles? I may just make a quick note about something before others jump in. I think this is actually a really good question for a lot of reasons, and one of those is that there's a big difference between licensed capacity and optimal capacity. So it's difficult. There's certainly going to be data on licensed capacity, but there isn't always easily accessible data on optimal capacity. If you don't have enough teachers for a particular room, or you're struggling for whatever reason to provide care for a certain number of children, you aren't necessarily, as a provider, always going to be able to accept your full licensed capacity. So I think this one's tricky for lots of reasons. But I'm curious if others have responses to this. The question was, do you know the accuracy of the slots on provider profiles?
This is a tricky question. I think the way that we were gauging accuracy had a lot to do with if there was a timestamp. So if the information had been recently updated, I think that was giving us a gauge of if it was potentially out of date or not.
I'm also interested in our agency leads point of view on updating and how easy or not easy it is to provide that access and verify and make it easy for, support the process for providers.
That's funny, Preetha, because I was going to suggest, or I was going to jump in to say, this is the exact reason why ours doesn't include it yet. It's outdated as soon as it's uploaded. And so we have heard about particular apps that you can buy and have the provider upload their number like on an app, and you ping them on whether it's a 2-week basis, a monthly basis, you decide, but we haven't jumped in to do that yet. So I'll say that's the number one challenge for us.
And oh, I have an echo too, but I'm going to just keep talking. So the Executive Office on Early Learning actually does not hold the child care finder in Hawaii. It is held by our Department of Human Services. I do not have that answer for you, but I could get it for somebody and we can send it out as a FAQ.
Kelly, I think you're muted.
Well, that's not helpful. Thank you for letting me know. So this one last question, I believe we're gonna end with this one is we have someone asking, do you know what the costs of each of these systems were to build it and maintain it? I'm sure that we didn't ask for the cost information, but I would be very curious here, Preetha and Katie, is there anything that you noticed? Was there anything obvious about that in your research? And then for the folks who I think, Dr. Grove, you are part of maintaining. Yes. Could you speak to like what all is involved in the cost and maintenance of a system like that?
Katie, I don't know if you agree, but that's something we did not look into. The cost of systems, and we had our framework and we stuck to it because uniform scoring, we were very intent on sticking with our framework apples to apples. So that was the scope of our study. Sorry.
No, that's okay. I think some of these questions are actually really nice ways of thinking about next steps. I think just because it didn't fit in neatly into this particular project doesn't mean that it's something that we can't explore down the road. So I'm really happy for these questions, even if we don't have answers for them. Dr. Grove.
Well, since you pointed to me, I will say two things. One is I do not know the total cost. I do know that some of the features that kept us in the middle category, we would love to have some of those exemplars that you pointed out, but cost is always a factor, right? So not only do we have sort of those logistical things, I mean, if you got enough money, you can buy whatever. I mean, we could buy all the technology in the world with enough money. So I will say that that will always be a factor. I do want to also echo that as a state leader, I would love this information. I would love to know about the platforms available and maybe the cost estimates or even a range. And so I really, really would love the Hunt Institute to lead the next sort of chapter of this work. And sorry, I couldn't give any actual numbers or anything, but we all want to know that.
Thank you, Dr. Grove. I saw
I
you
do know that in Oklahoma, we have a public-private partnership with Preschool Readiness, who is the policy partner. And for example, they use preschool development grant dollars and things like that to fund this. So it doesn't necessarily come directly from the Department of Human Services budget, which is very helpful. And having that third party quasi public entity running it is great. So where you have policy councils or things like that that can support something like this, it's very, very helpful.
That's a really great point, Representative Schreiber. And with the new PDG grants having just come out and being very focused on systems, this is a great time to be thinking about that. All right, wonderful. Well, it looks like our Child Care Finder Scale webpage is live. So I'm going to drop that. Actually, thank you, Christy, we have a behind the scenes person who's helping with all of these things and just dropped that webpage. So please take a look. We are also going to just be wrapping up with an evaluation here at the end. So please don't get too distracted by the scale just yet. I think Christy is going to be dropping the evaluation link for us. If you wouldn't mind responding to that before you hop off. I also just want to say thank you to everyone who took time to show up today to ask these great questions, to show interest in this topic. And I really especially want to thank our parents, our agency leaders, and especially our elected officials who took time out of their day to show up today and talk about this. They did a little studying ahead of time to be able to, see how their state scored and think about, what they might contribute. And I just want to say you all did a fantastic job. So thank you so much for showing up and helping us with this launch. And there's our evaluation. So please go ahead and take that, and then jump to the National Child Care Finder Scale page once you're done.